I want to introduce to you both Justin Lang and Samuel Dick, who are here with QDoc. They both are alumni of camp and Camp Nudimic and Red Rock Bible Camp. So they know and they understand and they get camp, which is great. I'm going to turn it over to you both right now. I'm not sure who's going to start off with it, but I'll let you take it away. And at some point when Daniel does come in, if we can have a good segue to just let him chat for a couple minutes about his experience, and then we'll come back to you as well. So Justin, Sam, welcome. Thank you. Take it away.
Thanks, Kim. Appreciate it. Yeah, nice meeting everybody. I know Nancy really well, but don't know too many others, but really nice that you guys let us just come for a little bit. We're just gonna, my colleague Sam here worked at Red Rock too. Sam, if you want to say hi. And I think
oh, sorry,
yeah,
Justin.
you go ahead, Sam.
Yeah, I was just gonna say, alumni at Red Rock Bible Camp. Hearing about the NL course, yeah, I was a lifeguard there for a number of years. Lots of good stuff, but it's exciting to be able to help out some camps or in some potential way.
Okay, we'll try to make it quick, but so yeah, Sam and I are with QDoc. So some of you may have heard of us, some of you may have not, and that's totally fine. So what we are is we're a virtual platform that connects patients to local physicians in real time by video. And it's at no cost to you. So it's free for everybody if you have a health card, and we'll talk a little bit about that later. Our mission is to provide equal access to quality medical care for all Canadians, regardless of geographic location or socioeconomic status. So we essentially want everybody to be able to get medical treatment if they need it. And we're trying to change the landscape of healthcare in Manitoba and in all of Canada. We know it's not great, and I'm sure you know just in your communities and stuff like that, that ERs are often full and the healthcare system is not always doing super well. Obviously, the pandemic was really hard too. But with QDoc, we want to be a company and a tool, I guess, in your toolbox, both for you as people, but also for you as leaders at your camps. And so we'll talk a little bit about how QDoc can help that. So our team, we have two guys who founded us about 2 years ago. So it's not a super old company yet, but our CEO is a doctor. He's an emergency pediatrician, and he's still working. He has 20 plus years in medicine and lots of experience in that. And he also, I believe, his kids have gone to Camp Masad with and he even, I think Norm did some vaccinations there, I believe, a year ago or something like that. Like they were running some stuff with COVID, or they were providing things with COVID. Danielle could correct me on that after, but so he's been involved with camps. And then Dave is our CTO, and he's got about 30 plus years in medical technology and managed a lot of projects. And these two guys kind of drive everything we do, but they know kind of about camps, and they've seen the value in it and had their kids go as well. So how does it work? So we've essentially developed software that allows you to be connected to a doctor virtually. Okay, so you essentially can go onto our website and you make an account with your email. You log in and then you enter your health info, and now you have a patient profile. So those are two separate things. You have an account with your email, a patient profile with your health information. And then essentially what you can do is you can click Start Visit. There's a button on the website. It's pretty easy to see it. Start Visit once you've entered that info, and you're entered into a queue where a doctor then can pick up your call, and they can have a call with you virtually. And so it's pretty exciting for us. It's like an Uber model in the sense. So the doctors are like our drivers and the patients are like our riders, I guess. And so we have doctors who, they get a ping, I guess, when someone enters the queue, and then they can kind of choose and take whoever's in there. And another great thing for us is that our pings, the way it goes is that we will hit people who are first in the location and who are specified for the care you need. So if you have, let's say, an emergency thing, well, maybe that's not a great example. If you have a women's health thing, let's just say, we have gynecologists who, they'll get pinged first, and them in the area, those who are in the area will get pinged first. And then if they aren't available, we ping gynecologists in the larger area of Manitoba. And if none of them answer, then we ping local just doctors in general. So we're trying to really make sure that the best doctor for the care you need is getting notified when you need it. Appointments can be done on any device with a camera or mic. So yeah, it can be an iPad, can be a laptop, can be your phone as well. We bill Manitoba Health just like any other doctor visit, so it's completely free if you have a health card. Now we aren't a replacement for a family doctor or emergent care. Like if you have a kid at camp or you yourself, yeah, like have crushing chest pain or a super bad injury, obviously go to the ER. We're not trying to replace that. And if you have a family doctor who you see every day or every few months and you feel like that's really good, then stick with that. That's great. You have great access to medical care. But QDoc is more for people who don't always. We know a lot of people don't have access to their family doctor, or sometimes you need a doctor in a time when it's not easy to see them, right? It's like your kid has a rash or you've got some kind of thing that you know you won't be able to get to them in time for. So that's what we want to do. We want to fill in those gaps. After visits, our doctors can write, or during actually, our doctors can write prescriptions for you if you need them. They can order lab tests. They can order x-rays, they can write sick notes. So a lot of things can be done. So if you need a prescription or you need some kind of medicine, it can be written for you during the visit virtually, and then you can go to your pharmacy and pick it up straight from there. So a lot of power in that to save you trips, just in terms of you don't have to go out and see a doctor to get that done. And again, all that is billed through Manitoba Health. So it's pretty much like a walk-in in that way, just virtually. So yeah, like I kind of said already, for how to see a doctor, it's pretty easy. You create an account. So if you were to do this as a camp, you could have a camp account where you created it with a camp email and a password. But if it's for yourself, obviously you can just do it with your own email. You can then create a profile, which is really easy. It's your name, your date of birth, some health info, your health card, your 9-digit health card. That's kind of your number. That's what we run everything through. And then, yeah, you click start visit and you're in the queue and you're waiting for a doctor. So it's pretty simple. Like the setup doesn't take very long. And I think we'll talk about questions later, but if it was to be used at camps, what you could do is you could have one central account, and then you could create profiles for campers if they needed it, if they were sick or if they had an injury. And that doesn't take long at all, assuming you have the information on hand, right? So, so why use QDoc at camp? Obviously, like I've worked at camp 4 years. I'm not a doctor, but we've had a few camps. We have a Camp Masad. We've had BB Camp who have used QDoc and really liked it. And I think a testimonial was sent out, or there was a little bit of info sent out in the campaign. So thank you, Rick, for that. We appreciate that. And this is also from them having used it. They told me, both Jane Kraut, who was a nurse at BB Camp, and also Daniel and Jan and Perry Rubenfeld, who is a nurse at Camp Masad, they said it saved them a lot of time. If they had injuries or illnesses that perhaps we weren't sure if it was worth going, they could talk to a doctor within minutes and get a doctor's opinion. I believe Perry said it saved them 15 to 20 trips. It's either Perry or Jane, so one of the two camps, but they said they saved them about 15 to 20 trips to the hospital that they didn't have to take because they were able to use QDoc. So it limits those unnecessary hospital visits. You can speak to a doctor within minutes. And then the cool thing too is that I know at Nudimic, and I'm certain at all the camps, there has to be a health officer, right? This is really good because if the health officer feels like there are things that are beyond their scope, beyond their knowledge, they can talk to a doctor right away and at least see like what the doctor thinks. Maybe the doctor says, no, this is something that you need to go to the ER, or the doctor can recommend doing a certain thing. So now you have that collaboration there. So again, we're here obviously not to replace anything, but I think for camps to know about QDoc and to have it in your toolbox, we think could be a really powerful way to just increase the quality of medical care. Especially because we know a lot of camps are rural, like very rural, and it's the drives are long and you have to take staff to go with kids, and the drive is not always easy. So that's a short little thing on QDoc. If you have any questions about it, feel free. I didn't want to take too much time. We'll probably be in contact with just more individually camps in general, so we can just see what you guys are thinking. And if there are any questions, obviously there's no pressure to use it at all, but we wanted to get the word out a little bit because we really think it can be a great tool for camps. And so we thought the MCA was a great place to go for that. So yeah, I don't know if Sam, you have anything to add on that.
Can I interrupt for just 1 second or butt in here that thank you for the information. You actually I'd written down 2 questions as you were talking and you answered them both in your presentation. So I appreciate it. But I know Daniel is here and maybe we'll get Daniel if you just want to share your story about using QDoc, and then we'll go back to Sam if you have anything, and then we'll have some time for questions. If that does that work?
Sure.
Awesome. Thanks.
Absolutely. We at Camp Masad used QDoc last summer for the whole summer, and found it very beneficial to have on site. It helped us avoid taking the kids off the campsite to go to clinics and to hospitals and to doctors, to wait and we were connected with doctors relatively quickly whenever we needed to do it. So like things like rashes and colds and other things like that were easily diagnosed online by the doctor, and then he would send the prescription along to the closest pharmacy that we deal with, and then we pretty much would get the service that we needed right away. And we were really impressed with it, how functional it was, and how it helped us to keep everybody on the site, especially with COVID going on. It was really great not to have to go anywhere. So it's a really fantastic program, and if you guys have good broadband internet and you have the ability to do it like this, I think it's a lot easier than transporting your kids all over the place to make sure that they see somebody to get the help they need. So I highly recommend it. I have nothing bad to say about it. It did exactly what we would need a doctor to do, and it did it in a good amount of time. And I understand that sometimes you might have to wait 5 or 10 minutes for a doctor to come. That's way better than waiting for 6-7 hours in a clinic. So I think it's fantastic. And so I would definitely recommend it to anybody who wants to try with camps, and not only with your camp, but I used it personally a few times last summer, and as camp directors, we're always the last ones to check our own health. But with a system like this, you can easily and discreetly see a doctor about something that you're feeling bad about in the summer without having to leave your site. Awesome.
So yeah, I guess just to add after what Justin was saying, just from my experience, I guess at camp, working alongside with the nurse or healthcare aide that was there, with QDoc, like what we can offer is we can kind of work alongside whatever nurse or healthcare officer you have there. That way it's sort of a second opinion for them if they haven't seen it very often. Oftentimes, at least for Red Rock, we had a lot of nurses that maybe worked with deliveries, but they still were a nurse, but they would just be able to come help with most things. But sometimes they haven't seen everything that, like a rash that looks awfully strange. So there's some stuff like that, but it's just maybe a second opinion, which is pretty helpful for, at least for us up there. We had a few times where it was a little bit unsure of what was going on. But yeah, there's a lot of things where I feel like QDoc can just be helpful for the staff as well. I was always told a bunch of times that 70% of injuries happen on the weekends. That's because the staff were just kind of goofing off, I guess. But for staff, it can be super helpful as well, because staff are committed up there the whole summer. It's hard for them to go home or hard for them to go back to the city to maybe go see a doctor. So this is another option for them as well, which is just something else to think about if maybe there's a prescription refill or something like that they might need.
Yeah, thanks for that testimonial, Daniel. And I just want to finish with this. So if you're thinking, okay, this sounds great, what do we need to, actually use QDoc at camp? So essentially, you do obviously need some sort of internet. If you have great cell service out wherever you are, great. I don't know if that's really always the case, but if you have Wi-Fi, then that will work too. And you need, again, a device with a mic and a camera, and you would need it in a private location, most likely, right? Because it's going to be a visit with a doctor, so confidential things may be shared. So if you have that, or you're able to at least provide that if a camper needs it, doesn't always have to be available all the time. That is essentially all you need for it. And one other thing I want to hit on is we want to provide value to camps in other ways. So we're looking to partner with camps. So if you guys are in need of certain health supplies or equipment, things for your first aid kits, just things you think, okay, well, we haven't replaced them in a while, but it would actually be really helpful if we had this at camp, EpiPens or things like that. I would encourage you to reach out to us, because we have connections with people in the healthcare industry just because of our co-founder and CEO, and we would actually love to help provide that for camps who are using QDoc. So yeah, that's just another option. I think we'll be reaching out individually, but if you have wish list items, especially health items, that you are thinking of, definitely I would say write those down and share those with us, and we'll be in communication with that, because we would love to help support camps in that way as well, just to be another way to keep camps safer and then provide better access to medical care. So, but yeah, thanks for your time. We appreciate it. And yeah, if you have any more questions, we'll love to answer.
Thank you, Justin and Sam. That's awesome. Just further to your last comment you said about supplies, could you write something up for us to put in our camping to let people know that? Because I know medical expenses are a huge cost, and especially when you said EpiPens as well. I know that when camps replace those on a regular basis as well, it can be a pretty expensive thing.
Right.
So if you want to write something up for me, we'll throw it in our next camping that goes out. That'd be awesome.
Great.
Before you both go, I am creating a space for a thing on our front page, and I'll be sharing on our social media platforms as well, so that people know that this is a great idea, and I guess the MCA is now endorsing it as well, so that this is a great idea. Like, I can't see anything that is as a hindrance here. So we'll be sharing your stuff camp wide from now on.
Appreciate it. Yeah.
Are there any questions from anybody about this to either Samuel or to Justin? Yeah, any questions, or Daniel, he might even be able to share more about his experience from that perspective as well. Anyone?
Yeah, I had a question. So if we had campers who are from out of province, like Ontario or even the States, would they be able to use, like if they had their own private insurance, would they be able to use that and use QDoc?
Yeah, so if they're from Ontario, we have an option there where you can enter in a different health card from a different province, and Manitoba Health will just bill the Ontario government on behalf of that. So that would work great. I think the States is a little more complicated, but if they have private insurance, what can be done is QDoc, like, we can be notified of that. And then we can actually see if we can bill privately. So what would happen though is they would probably have to pay, and then we would be reimbursing, like they would have to get reimbursed, by their insurance. So it's a little more complicated. And that would probably, like, let's say the camper had a visit afterwards, it may require a call, like just a call with us. We have our helpline, which is always, like, it's open 8:30 to 4:30 Monday to Friday. So that would just require a call, just say, hey, this camper has this insurance, can we work on billing? And that could be done, but it's just a little more complicated, but it can work. Yeah.
Awesome.
Thank you.
I think too that yesterday at our AGM that we had, Lexi from BB Camp had shared that the doctors can also write prescriptions in Kenora for the Shoppers Drug Mart in Kenora, because we have 4 camps and 2 additional ones who use our camps in Northwest Ontario. And she said that she used it, and the docs were able to chat with them, get a prescription to Kenora shoppers, and still be able to take care of that. So do you want to talk further on that?
Yeah, so because of the College of Surgeons and Physicians, you have to be physically located in either Manitoba, Northwest Ontario, which includes Kenora, or Nunavut. So if you're from any province, obviously, as long as you're physically located in those areas, we can operate as normal. And so yeah, Kenora is great. So it's like I said in the presentation, that's the exciting thing too, right? Is it's not just seeing a doctor isolated, we're connected with, and like almost any pharmacy. If a pharmacy is not on our system, if you just ask the pharmacy to contact us, we can always add them, and then it's really easy. We just send them directly to pharmacies that way. So yeah, it's a powerful option, I think, that we have with it. So
For sure. Any other questions?
Maybe just a comment on the out of province thing. We used it a couple times last summer, and I had a staff member from the Netherlands, and he did a scan of his health insurance card, and that was it. We never saw a bill, nothing. And
Wow.
like for us, it's been absolutely incredible. Like the amount of time and energy that it takes to get a kid or a staff member out of our location to a doctor and back again. You've blown an entire day and like a couple tanks of gas, and it is just so slick. We just get the prescription sent to a pharmacy close to our office in the city, and the next van up has a prescription in it or whatever it is. So nothing but praise for them.
Awesome.
That's
Thank you,
awesome.
Gord. That's great. Has anyone else who's on here used QDoc before besides Daniel and Gord? Okay. That's great. Any other questions? Well, you gave lots of great information. Apparently that you've answered whatever questions might be there. And my guess is that camps will be using this a little bit more now this next year and save some time, some energy, some trips to town from some of those remote locations. That's awesome. We should have asked this permission, I guess, in the beginning. Are you both okay, Justin and Samuel, with us putting this link, because I know Rick has recorded this, onto our website and to send out to our camp so they can get the information? Awesome.
Yeah.
Most definitely, yeah.
Okay, perfect. That's great. Thank you so much. I think it's a great resource for our camps. I think the years that I directed camp, sometimes we could have saved trips going into Kenora. Whew, would have been really nice. So this is super that you're going on with this. Thank you.
Yeah,
You're
thanks
welcome
for
to
having us.
stay. Sorry.
You're welcome to stay. Okay, well, maybe we will.
Yeah. Thank you.